discussing on certain ethical principles which we need to know. So the veterinary practice is primarily across the globe is based on the principalism. So where we are supposed to follow the autonomy. Say, consider you are working as a veterinary assistant surgeon. You can learn whatever the technique we teach, but you are supposed to follow the autonomy. That means if there is a direction from the director of veterinary services or the regional joint director, you are supposed to you are bound to do that. So autonomy plays a vital role. So this is where we need to balance. You may be interested to use an sedative, anesthetic, but the joint director or director may be telling that no, it will not be supplied to the dispensary. So the other three principles has to be managed. Beneficence, that means you have to promote the well-being of the patient presented to you and do no harm. That's all. You are bound to go with autonomy, but still you have one more principle, justice, equitable. So the allocation of equitable resource or equitable resource for that particular patient. Imagine you are presented with a case. You do not have proper medicine because of this autonomy. So you have control over these other three. With the other three, you have to promote the well-being. That is, across the globe, this is the principle. The medical practice goes only with this. So it is our bound duty and ethical duty to take care and modify as per the requirement. So you cannot fight with the JD that it has to be supplied. No, we are bound to go by the rules. So autonomy will be there. So you have other three. So use that principle and try to do the best possible care for the animal. So this is very, very important, that has to be understood. So as I was telling, detailed physical examination in large animal practice is vital. In the absence of diagnosis, if you do a surgery, it is going to be a trauma. So last week I had a experience. See, the retired regional joint director called me over phone. He was supposed to open a swelling, assuming that it was a case of hernia. So the case was referred to teaching hospital. So there they have diagnosed it as a seroma abscess, sent back. So he was arguing with me that we have come with a team, we want to open. So he was showing me literally live video call. There was a necrosed muscle mass coming out through the incision he has made, and he is planning to open it, saying that there is a depression, that there is a herniation of content. I told no, that's all. And it is being heard by the owner because it was live. So naturally video call, so owner can hear. So in the absence of, he has made a attempt. Yes, I appreciate. I told him, yes, I am appreciating. Retired person, preparing the animal, coming with a team to operate. Yes, definitely. But it was a wrong case. Suppose if he could have opened it. I asked him, what is your plan, sir? You are going to open. Yes, where? In the flank region. Okay. What is the suture material you have? He was asking the junior, what suture material? He was telling Vicryl number 10. With 10 flank he is going to open for a large animal, almost 350 to 400 kg, big HF cow. Suture is not going to stay there. Probably he can suture skin. Muscle, no. If he is opening, that's all. It is going to end up with wound adhesion. I told him, no, you do not have any resource to tackle this particular case on that particular condition, in the farmer's premises. So you do not have anything. It is 20 30 kilometers from E-Road, you cannot open and then you cannot go and get a suture material. No, cancel it. Probably you do a counter opening to facilitate drainage. The complaint was it is continuously draining. Yes, I told him, yes, when 30 centimeter scale, when it can go into the cavity, definitely there will be a secretion. That has to stop. It will take time. So don't jump into a conclusion and don't attempt to do surgical intervention without diagnosis. If you are going to do that, it is going to be a harm for the animal. It is not going to be not going to promote the well-being. So all these things you know. So in nutshell, we are going to deal only these things. So when you talk about veterinary clinical practice for a surgeon or for a surgical intervention, it is a palpable science. Whatever diagnostic modality you use, you have to palpate, and because you are going to operate, you are going to intervene using your hands. So definitely, apart from all these four, you have to learn the palpable science. How it is, consistency has to be felt, and accordingly it has to be decided. So facial swelling, anorectic. So generally we will assume that there is a swelling, so we will be assuming liver fluke, something. We will be doing deworming. So when you do, so it is an unusual case. Maggot wound in the oral cavity. Maggot wound doesn't happen in oral cavity, but still. So these are all the results of detailed clinical examination. When you do it, yes, you can find. Very simple. Treatment is very simple. Only thing is you have to have a diagnosis. And as I was telling, xylazine butorphanol ketamine stun or chemical restraint is going to improve your efficiency. So this is a Jallikattu bull. Probably it will be weighing 250 kg, but you cannot control. And it got an injury on the tongue. It has to be sutured. So without a chemical restraint, it is very difficult. You cannot. Either you have to cast it, tie all the legs. Even then, tongue it can pull. You cannot tie a tongue and you cannot do a suturing. So under such circumstances, you need a chemical restraint along with local analgesia, so that the intervention, very simple intervention. Intervention is nothing. We are going to do only simple interrupted suture. But the only thing is how we prepare, how we are going to tackle that particular case is the most important thing that determines the successful outcome. And similarly, horn amputation, probably with carnal nerve block, yes. But for that 1 minute or 1.5 minutes, animal has to cooperate. That's all. You need a chemical restraint. You cannot, because this is a confirmed case of cancer, squamous cell carcinoma. You are supposed to do a horn amputation, but it is a Jallikattu bull. Naturally, it is going to be anxious, ferocious, or it is not going to allow the surgical interventions to be carried out. So you need a chemical restraint. So the importance of the chemical restraint, wherever it is required, go for chemical restraint. That's all. Very simple. Then coming on to wounds requiring meticulous reconstruction. See, it has a lacerated wound caused by some sharp object. Without surgical intervention, this wound will definitely heal. You don't need a veterinary intervention. The only complication after 6 months will be, it will go for eversion of eyelid, ectropion, dry eye, keratoconjunctivitis sicca or dry eye leading to corneal opacity or vision loss. That will happen after 6 months or after 1 year. Meticulous reconstruction will preserve the vision after 6 months or after 1 year. Even after 1 year, you can maintain the vision. But for that, you need a meticulous reconstruction, because you are not supposed to cause deliberate surgical ectropion. So for such animals, definitely you need a chemical restraint and local infiltration. Only two things. Chemical restraint 1 to 3. Probably this animal is 300 kg. You require 1.5 to 2 ml IM. Animal will be cooperative. It will be standing simply. you will infiltrate local anesthetic, you will be doing suturing. That's all, very simple. So understand the importance. This I have discussed. So peribulbar block. Peribulbar is nothing but peri, around the globe, around the eye. So when you want to do torsography, most of the time we confuse chemosis with other conditions. Chemosis is catarrhal inflammation of conjunctiva. It can happen due to allergic reaction. That's all. Simple thing is you need antihistaminics, you need potent anti-inflammatories, you need torsography. That's all. For torsography, auriculopalpebral block is causing only motor blockade. It is not going to cause you analgesia. So just infiltrate local anesthetic around the eye, do a simple suturing. Make sure that you don't go into the conjunctiva because it will cause erosion on the cornea. Just infiltrate local anesthetic, do a simple suturing. That's all. So animal will recover in 3 to 5 days. So this is a common condition. So this I was discussing. So there was a question. So whether to use this LAVA-2 for intravenous use? No. So the lignocaine intended for intravenous use is preservative free. It will not have any preservative. So lignocaine, preservative free lignocaine, loxicard is meant for IV use. And we know lignocaine as local anesthetic. But when local anesthetic lignocaine is administered intravenously, it can cause effective analgesia. So intravenous lignocaine can be used in routine canine practice, in bovine practice, in equine practice. It is not indicated for cat because lignocaine can cause toxicity. So lignocaine cannot be used, lignocaine CRI cannot be used for felines, cat. Bupivacaine can be used only for local anesthesia, local analgesia. Bupivacaine is more cardiotoxic and it should not be administered intravenously. So the preservative-free lignocaine can be administered intravenously to achieve analgesia. And when you want to use lignocaine as a painkiller, intravenous route, you have to give a loading dose. The reason is like sulfa, there will be peak and trough concentration. You cannot maintain. So when it comes to the trough, it will not be producing effective analgesia. So to avoid that, initially we will be giving a loading dose of 1 to 2 milligram per kg. And then over a period of time, it can be administered. That depends on the duration, how long you want. It can be administered up to 4 hours. Yes, it can be given. Only thing is, you have to calculate how much quantity of lignocaine is required for that particular animal for 4 hours. So calculate from milligram per kg per hour basis. Then administer that quantity in divided dose in each bottle of fluid you are going to give. And epidural. So lignocaine with adrenaline should not be used. Lignocaine, probably it may have effect for say about 180 minutes. You want extended duration. The simplest technique is xylazine can be added. Xylazine has alpha-2 action. So xylazine can be combined with lignocaine for epidural use. Or xylazine alone can be used epidurally to achieve prolonged duration of action, prolonged duration of analgesia. And animal will be recommended for a prolonged period of time. You have to tell the owner that it will take care of straining, but the limitation is it can have prolonged recumbency. So 0.05 to 0.1 milligram. With 0.05, definitely it will do wonder. It will produce excellent relaxation and extended duration of analgesia. So definitely you can combine lignocaine with xylazine or xylazine alone at a lower dosage to achieve extended duration. So loading dose 0.5 to 1 or sometimes 1 to 2, that depends. And intravenous lignocaine acts through GABA receptor. So it is an inhibitory neurotransmitter. So through GABA receptor, it has so many action, but through GABA when it acts, it produces analgesia. That's all. So when you use intravenous lignocaine, you achieve analgesia. First advantage. The second advantage is it has prokinetic effect. So that is the reason for equine colic management, they use lignocaine CRI to induce motility. Consider a situation wherein you are operating a animal, cattle, for cesarean section or for a GI disorder. So definitely they will have visceral pain. So that visceral pain can be easily managed with intravenous lignocaine, and simultaneously, because of its prokinetic effect, it will stimulate intestinal motility. Yes, Satish. Probably with NS ideal. Oral also we are doing routine fluids we are giving, because when you calculate for a longer duration, it is preservative free. So probably you will have only 1 to 2 ml for a long duration. When you calculate for a 300 kg animal, 4 hours, you will be probably adding 2 to 3 ml per session. So nothing happens. So definitely it is going to achieve the concentration, and it is going to achieve the desired effect. So definitely you can see the decreased pain response from animal. So definitely it can be used. And apart from that, it scavenges free radicals. So that is one advantage. So that was the question. So repeated manipulation of dystocia case, and finally one veterinarian is attending, he is operating, and animal collapses. Whom to be blamed? So naturally it will be under stress, because all the previous veterinarians, they may not have employed analgesics. So animal would have undergone severe pain induced stress causing adrenaline release. This actual veterinarian who is attending and doing surgery will be actually planning for the good outcome, but animal would have collapsed during surgery. This is because of the fault or mistake done by the previous vets who have not concentrated on pain induced stress. So under such circumstances, this may have a beneficial effect. I cannot guarantee 100% it will succeed, but definitely it can take care of the visceral pain arising due to manipulation, repeated manipulation. So that is one thing. So probably for a 300 kg, you require a loading dose of 7.5 ml. This 7.5 ml you add to first bottle of NS or any fluid. So administer slowly. Then later, probably you will be requiring 15 to 30 ml for 1 hour. So this 15 ml can be divided into 4 sachets. Each sachet will have 4 ml. If you want to extend the duration, still it can be reduced. It depends on the circumstance, how long you can be with the animal, how long you can administer. So based on that, this can be done. So Loxicard is preservative free, and you will have a typical indication for IV use. So remember that and try to use Loxicard. It is very cheap. 50 ml will be 35 rupees. So try to go with this preservative free lignocaine preparation for intravenous use to achieve analgesia. So coming on to orthopedic injury. This is the most common case in large animal practice, surgical case. Wound, next is orthopedic injury. So for managing an orthopedic injury, you need very simple gadgets. You need a PVC splint. So PVC pipe, everywhere it is available. You cannot say that it is not available in Theni. Everywhere it is available. So PVC splinting is available. Fiberglass cast, POP cast, again you can make readily available within 24 hours. So with the PVC splinting, most of the cases can be definitely effectively managed. Probably you may require fiberglass cast, but not immediately. You will have a breathing time. So During that time, it can be arranged. But for an emergency purpose, you need a PVC splint, you need a adhesive tape, and even if it is a tibia, you want to make an angulation, you need only a spirit bottle and a lighter and a cotton. So you can pour spirit, light it, you can bend the PVC splint as per your requirement, attach it, bandage it. So this is a very simple technique. You need a hacksaw blade to cut the PVC pipe, that's all. So only these are required to manage the serious orthopedic injury such as long bone fractures. Other thing, fiberglass cast and plaster of Paris. So the carry home message is no open fracture should be immobilized with plaster of Paris. This is the common mistake everybody does under field condition. Open fracture, you know pretty well that bone has come out. There is a wound, there is a discharge, there is moistness. So never ever apply POP for a open fracture case. Take it very seriously. You are going to do only the harm, because it is going to get infected. You are ending with osteomyelitis. Osteomyelitis is very difficult to treat. It is going to end up with non-union, that's all. It is not going to end up with malunion. It is not going to end up with non-union. The fracture is not going to heal at all. And you cannot spend money to tackle osteomyelitis with antibiotics. It is impossible. You can tell them to dispose of the animal. Culling is the best thing you are doing good for the owner, because he will be repeatedly administering third generation cephalosporin. No, you will not have desired outcome. The animal will not come back to the productivity because of the fracture when it is having osteomyelitis. So osteomyelitis can be iatrogenic because of faulty selection of cast material. Fiberglass, if you want to use, provide a window. When you provide a window, definitely the strength of the cast is going to decrease. Yes, it is unavoidable. You cannot avoid. But at least you will have an access to dress the wound, or the owner, you can advise them to dress the wound daily so that you can prevent osteomyelitis. So these two are the important carry home message that has to be remembered. Consider, you are presented with a Jallikattu bull, intractable. Why I am mentioning Jallikattu bulls repeatedly means, so this is the one which is intractable. When you can do immobilization in a Jallikattu bull, a cow definitely very comfortably you can do. So that is the reason why I am presenting with examples on Jallikattu bulls. So try to give a sedative, xylazine, anything, whatever you have, butorphanol, ketamine, anything, whatever you have, first sedate the animal. You need to achieve reduction. See, this is the X-ray image. There is a overriding. See, when we met with an automobile accident, humans, immediately we are shifted to some hospital. Next day they will operate. Ganga தூக்கிட்டு போங்க உடனே ஆப்ரேட் பண்ணுவாங்க. Yes, they maintain that SOP. But why it is not possible with veterinary patients? Very simple. அலங்காநல்லூர் ஜல்லிக்கட்டு last year it happened. வாடிவாசல திறந்தாங்க, animal had a fall, it had obviously liveல போயிட்டு இருக்கு, சன் டிவில liveல போயிட்டு இருக்கு. Everybody across the state are watching live. So it got fractured. At least all veterinarians, whoever is watching, will know that that animal sustained injury. It is having metacarpal fracture. And the animal metacarpal fracture ஆயிடுச்சுன்னா அங்கேயே நின்னுச்சா? No. அது கலெக்ஷன் யார்டு வரைக்கும் ஓடும். கலெக்ஷன் யார்டில் இருந்து அங்கேருந்து 2 கிலோமீட்டர் ஓடும் வித் ஃப்ராக்சர்டு மெட்டாகார்பல். வாடிவாசலில் திறந்து அந்த இடத்துல it would have been a closed fracture. Very simple, uncomplicated fracture இருக்கும். But because of the temperament of the animal will be running, there will be soft tissue, extensive soft tissue trauma. ஒரு மனுஷன் போகிறான், ஒரு வண்டி பைக் அடிச்சிடுச்சு, ரோட்டில் விழுந்துட்டான். he will never move. எவனாவது 4 பேர் தூக்கி ரோட்லேருந்து ஓரமாக வச்சா தான் அவன் உட்காருவான். அது வரைக்கும் அவன் எந்திரிச்சு ஓடி போய் ரோடுக்கு அந்த சைடோ இல்லை ஆஸ்பத்திரிக்கோ ஓட மாட்டான். ஸோ in humans, the soft tissue trauma associated with osseous injury or long bone fracture will be minimum. ஏன்னா செல்ஃப் இன்ஃப்ளிக்டடாக இருக்காது. Whereas in veterinary patients, it is reverse. Self-inflicted soft tissue trauma associated with long bone fracture is very common. So, fracture outcome, fracture la heal ஆயிடும். Whether it will walk, whether it can go for the other show, other ஜல்லிக்கட்டு ஈவெண்ட்டுக்கு போகுமா அப்படின்னா, that depends on the soft tissue healing. Soft tissue கரெக்டாக இருந்து டெண்டன்லாம் கரெக்டாக ஹீல் ஆகிடுச்சு அப்படின்னா, yes, it can perform. If there is contracture, it is not going to have the previous performance. So, the soft tissue has to be taken care. So, your splinting, whether it helps in bone healing or not, but your simple PVC splinting will help further damage to the associated soft tissues. It can be a joint capsule, it can be a tendon, it can be a ligament. So, that is going to determine the fracture outcome. So, you have to have a traction so that you can reduce the fragment. You can align it so that you can have a proper healing. So, to achieve this traction, only when the animal is under chemical restraint, you can have this. Otherwise, it will be struggling. You will do bandaging with overriding, and it is going to end up with malunion, not fracture, normal fracture healing. And it can remodel, but probably it will take 2 years for remodeling phase to take place. And by the time, animal will lose its performance. So, you have to put a traction and you have to have a counter traction. Counter traction, the owner can give traction, at least veterinarian or whoever is assisting the veterinarian can give a traction. And try to apply boric acid powder so that it doesn't cause irritation, it doesn't cause discomfort for the animal. So, you have applied splinting, but if the animal is feeling discomfort, நமக்கு வந்து ஒரு கேஸ்ட்டை போட்டாங்க அப்படின்னா அரிச்சு இது சொரியணும்னா ஒரு கம்பியை கொடுத்துருப்பாங்க, உள்ளே விட்டு சொரிஞ்சிக்கலாம். சீக்ஸ் எல்லாம் டர்பன் கட்டியிருப்பான், ஆனால் காதில் ஒரு குச்சி மாதிரி ஒரு கம்பியை வச்சுருப்பாங்க, ஏன்னா தலை அரிக்கும், அதை எடுத்து சொரிஞ்சிக்குவாங்க. ஸோ அனிமல், it will have itch if you do not apply properly the cast. So definitely it has to stamp. அதுதான் அதை அவ்வளோதான் பண்ண முடியும். ஏன்னா we have immobilized from elbow to digit. So continuously if it is disturbing, the fracture is not going to heal. So that is the logic behind cleaning and applying boric acid and properly applying the padding. When you apply it tight, and if it is applied in a wrong way, definitely again it is going to cause discomfort for the patient. So proper padding, apply the PVC splint and try to do. And if you do not have adhesive, make use of the bandage roll. So make it and try to place the knot on the splint, not on the tissue. If you put the knot on the other side, it will be exerting pressure on that particular tissue, or pressure point will be over the soft tissue. So it will be causing additional stress to the animal. So always put the knot over the splint. So these are all very simple things. And imagine you have a metatarsal fracture. Try to have a curvature and try to include tarsal hog, so that you are just going to make a curvature. You are going to heat the PVC pipe and you are going to make a curvature, and it should smoothly fit into the curvature. Definitely the fracture immobilization will be very effective. And try to remember, the splint should be in level with toe if it is applied on the cranial aspect. If it is applied on the caudal aspect, it should be in level with heel. So this is very, very important thing. Commonly it is not well understood. Imagine if you are keeping the splint at this level, it is not going to serve the purpose. Imagine if it is placed on this side, and if you have the splint up to this level, the animal will be placing the entire weight on the splint and splint will be moving. When the splint moves, it is not going to cause effective immobilization. So when it is applied over the cranial side, it should be in level with toe. If it is applied on the caudal side, it should be on the heel level. So for forelimb, most of the time we place it on the caudal side. For hind limb, it is placed on the cranial side. Reason is to maintain the angulation. What will happen if you put the splint on the opposite side? For a hind limb, you are putting the splint on the caudal side. So what will happen? The stifle will be straight. There will be contracture of gastrocnemius tendon. So animal will recover from fracture, but it will not be walking properly. So these are all very simple things. So caudal in level with toe. So additional padding should be given for the pastern region, because most of the time they will heal, but because of the pressure exerted on the dew claw, animal will not be bearing weight properly after fracture healing. So you have to avoid pressure on the dew claws. So put extra padding or cotton roll over the pastern area below as well as above and try to immobilize. So with bandage, you can definitely make knot and you can achieve immobilization. So when you do fiberglass, it can be reinforced or it can be simple as per your requirement. If you are affordable, if the client is affordable, go for fiberglass cast, 3 rolls, 4 rolls. If the owner is not affordable, probably you can combine it with PVC splint. The advantage with fiberglass is you can go along the shape of the limb. If you incorporate PVC, that is limited. So there is one advantage, one limitation that has to be. So cost benefit. So according to your client, you select. And definitely this animal is having an open fracture. I need a window. When you make a window, definitely the strength of the cast is going to decrease. So I am combining PVC with fiberglass cast. That's all. So either way I am compromising on one part cast, on one part the strength of the cast. So it depends on the owner's affordability, type of fracture. When there is malicious injury, this is a malicious injury, everybody knows. So when you do surgical reconstruction, always remember that the entire limb has to be immobilized, because this tendon cannot heal with your suturing alone. It has to be immobilized. The principle of wound is, last point is surgery is immobilization, because any wound, if it is immobilized, it will heal rapidly. So to achieve complete healing, malicious injury involving gastrocnemius tendon, you are supposed to do immobilization of the limb to facilitate healing of the sutured wound. So this is again. Radial nerve paralysis is common sequelae of humerus fracture. Humerus bone is the strongest bone, and if it is getting fracture, there should be a violent force over the shoulder, and violent force can cause direct trauma to the radial nerve, or because of humerus fracture, probably if it is falling in an awkward position, and if that causes humerus fracture, fractured fragment of humerus can cause damage to radial nerve. So now the question is, this is a typical Jallikattu bull, it is a delayed presentation. From the picture itself you can make, because all the things they have attempted, heart fermentation, pathu pota, ellam pota, but very simple technique. Put a artery forceps on the dorsal aspect of pastern, fetlock. If it is withdrawing, radial nerve is functioning. If it is not withdrawing, fracture will heal. Animal will not bear weight, because radial nerve is required for extension of fetlock. Dropped elbow, flexed fetlock. No, it is not going to serve the purpose. Whatever you do, delayed case, already damage has happened. So prognosis you can very clearly tell them. So radial nerve paralysis following humerus fracture is very common. Assess the function of radial nerve whenever you encounter injury involving humerus or arm region. So this is a typical case. So animal is having humerus fracture. So non-weight bearing lameness, okay, that is okay. But it is not having functional radial nerve. So it is dragging. So there is no pain sensation on the dorsal aspect. Probably immediately if it is presented with potent steroids, aggressive steroid therapy, probably B12, you can recover, but not always. If it is a delayed case as the previous one, the prognosis is definitely guarded to poor. So hip dislocation, simple observation, examination, definitely you can make. You don't require high-tech diagnostic technique for diagnosing hip dislocation. Bilateral, yes. Tail fracture. So don't advise the owner that this can be corrected by application of POP. So this is also very common mistake. See, it is because of pull, the tail coccygeal fracture happens, and there is a gap between two fractured fragments, and you cannot achieve immobilization in a tail. So this is a common mistake. When it is the bone got broken and the distal fragment is somewhere here, proximal fragment is here, you cannot immobilize the tail to achieve fracture healing. So this you have to go for amputation. Slip-ups, common mistake. Don't tighten the splint. Commonly they do with the jute or bamboo stick. Bamboo stick la நாம இன்னும் 1950 லாம் இல்ல, இது சுதந்திரமா வாங்கி 75 வருஷம் கொண்டாடிட்டோம். Never ever follow the old, very old World War II ல பண்ணாங்க. World War II பண்ணும்போது செல்போனே இல்லை. அப்போ அந்த வெட்டினரின் செல்போனே வச்சிருக்கூடாது. Now we have advanced. Science is, change is permanent. You cannot tell 50 years back they were doing. Yes, 50 years back they were doing. அப்போ there is no PVC. PVC 1950 கண்டுபிடிச்சிருக்க மாட்டாங்க. PVC பைப் இருந்திருக்காது. அப்போ they may not have resource to manage that fracture. But now it is available. When you have a better option, why to stick on with bamboo stick, which is going to cause additional trauma? So never ever do that, and never leave distal portion, because if you are going to leave distal portion, you are going to end up with edematous swelling, you are going to compromise circulation, soft tissue damage is going to happen, it is going to completely stop the fracture healing. This only with that particular area they will be putting the POP. How it is going to heal? No, இதுக்கு நீங்க போடாமே அனுப்பலாம். It is doing harm. Never ever apply POP only for that fractured fragment. See, you have to immobilize one joint above and one joint below. Only then the fracture can heal. Never ever apply POP only over the fractured fragment. It is not going to serve. அதுக்கு நீங்க பண்ணாம இருந்தாலே அது ஹீல் ஆயிடும். ஒரு காட்ல 1000 மான் இருக்குது, ஒரு 10 மானாவது அடிபட்டு ஃப்ராக்சர் ஆயிருக்கும். It can heal. Bone can heal on its own, even without intervention. ஒன்று மால் யூனியனுக்கு போகும். ரீமாடலிங் will take 2 years or 3 years, but it will heal. மான் காட்டில் அடிபட்டு இருந்ததுன்னா அது ஓடாது, அது எங்கேயாவது உட்காந்துக்கிட்டு எங்கே தீனி கிடைக்குதோ அதை மட்டும் சாப்பிட்டுட்டு நாம் அதை தான் மேய்ச்சலுக்கு ஓட்டிகிட்டு போகணுன்னு நாம் deliberately we will be doing additional trauma. So when you are presented with a case like this, never ever apply a POP cast over the fractured side. So this animal is a typical ஜல்லிக்கட்டு bull fracture. So இவ்வளோ ரோப்பு கட்டியிருக்காங்க ஃப்ராக்சர் ஆன அனிமலை, இல்லைனா குதிச்சு வெளில வந்துடும்னு. This animal requires sedation for transportation. இந்த அனிமலுக்கு தேவை நீங்கள் ஃப்ராக்சரை இம்மோபிளைஸ் போகவே முடியல, அட்லீஸ்ட் யூ sedate the animal and send it. க்ளோஸ்டு ஃப்ராக்சராக இருக்கக்கூடிய எல்லா கேஸும் பிகாஸ் ஆஃப் violent struggling due to pain, the closed fracture will become open fracture. So such cases warrant chemical restraint. And this is a typical abscess. Don't make stringent opening. குட்டியோண்டா போட்டிங்கன்னா அது சிக்காட்ரியல் கண்ட்ராக்ஷனில் பிஃபோர் ஹீலிங் இட் வில் கண்ட்ராக்ட். நீங்கள் போட்ட இன்செஷன் வந்து க்ளோஸ் ஆகிடும். ஸோ நைடஸ் வில் பி இன்சைட், இன்ஃபெக்ஷன் வில் பி பர்சிஸ்டிங். இட் வில் கோ ஃபார் chronic abscess. It will be a headache both for the owner as well as for the veterinarian who is attending subsequently. ஏன்னா நீங்கள் போட்டுட்டு போயிடுவீங்க, சரி இல்லைன்னா அடுத்த வெட்டினரியன்ட்ட போகும், அவனுக்கும் அதை ஓப்பன் பண்ணவும் முடியாது. சிக்காட்ரியல் கண்ட்ராக்ஷனில் இருக்கிறத we cannot open. It is going to cause bleeding. So nothing can be done. So if you can open it, open liberally, drain the content. இல்லையா இது பண்ண முடியாதா, யார் பண்ணுவாங்களோ அவங்க ரெஃபர் பண்ணிடுங்க. That's all. That is the good thing you are doing. Referring is not considered as a inferior thing by the client. நமக்கு தெரியல, நான்லாம் காலேஜில் கண்டிப்பாக சொல்லிடுவோம் ஓனர்கிட்ட, எனக்கு தெரியலன்னா ஐயா எனக்கு தெரியல, நான் இவ்வளோ தான் எனக்கு தெரியும், இவ்வளோ தான் இது சந்தேகமாக இருக்குது, இவ்வளோ தான் பண்ணலாம் அப்படின்னா எந்த ஓனரும் அதுக்காகலாம் யாரும் சண்டைக்கு வர்றதே கிடையாது. நெவர். ஓனர் யாரும் எனக்கு தெரியலன்றதுக்காக, டாக்டர்ஸ் தெரியலன்னு சொல்கிறதுனால சண்டைக்கே வர்றதில்லை. நாம் அவங்கள ப்ரொவோக் பண்ணுறதுனால தான், ராங்காக கைட் பண்ணும்போது தான், ராங்காக ப்ரொக்னோசிஸ் சொல்லும்போது தான் we have difference of opinion. So if we say we do not know, அந்த கிளையண்ட்லாம் லூஸ் பண்ணவே முடியாது. அப்படின்னா காலேஜிலேருந்து ஒரு இன்னொரு வெட்டினரியன் ஃபீல்டுக்கு போயிட்டு திருப்பி அவங்க எப்படி காலேஜுக்கு வர முடியும், திருப்பி எப்படி ஃபோனில் ஒரு கான்டாக்டில் வச்சுருக்க முடியும்? இட் ஆல் டிபெண்ட்ஸ் ஆன் ஹவு வி கம்யூனிகேட் வித் த கிளையண்ட் அண்ட் எக்ஸ்பிளைன் த கண்டிஷன். ஸோ ஸ்லிப் அப், அண்டர்ஸ்டாண்ட் தி ஃப்ராக்சர் பயோமெக்கானிக்ஸ் அண்ட் ஸ்டெபிலைசேஷன். ஸோ put a PVC spin, padding, just immobilize, send it, that's all. Abscess lancing, do properly, that's all. Drain the content completely. Referral to institution or to any fellow veterinarian. யார் பக்கத்தில் இருக்காங்களோ try to develop the habit of referring. So linear infiltration. So there was a question. If you want to make a surgery here, linear infiltration should be cranial and dorsal. It should not be ulta, right? So inverse inverted L அப்படின்னு சொல்லும்போது மாற்றி போட்டுருவாங்க, இப்படி போட்டுருவாங்க அல்லது அப்படி போடுவாங்க, என்னவோ எல்லுன்னு சொல்கிறாரு, எப்படியோ போடு அப்படின்னு. ஸோ இட் ஷுட் பி ரிமெம்பர் சிடி, இட் ஷுட் பி cranial to the line of incision and it should be dorsal. ஏன்னா நர்வ்ஸ் அப்படி தான் வரும். திஸ் இஸ் வெரி சிம்பிள். ஸோ தெர் வாஸ் ஒன் கொஷின், இப்போ பேராவெர்டெப்ரல் போட்டுட்டு நாங்கள் சிஎஸ் தான் சார் காமனாக பண்ணுறோம். எஸ், paravertebral can be used to perform cesarean section in cattle. Even T13, L1, L2 தான் பிளாக் பண்ணுறோம். For cesarean section, animal will be recommend. நீங்கள் ரெக்கமெண்டில் தான் பொசிஷனில் தான் பண்ண போகிறோம் அப்படின்னா even you can go up to L3, nothing will happen. ஒரு சைட்டுக்கு 25 ml இருந்து 30 ml போடுறோம் அப்படின்னா 4 சைட் பிளாக் பண்ணாலும் you will be using 120 ml of lignocaine for ஒரு 300 kg to 400 kg animal, nothing will happen. If you do it properly, comfortably, நீங்கள் L3 block பண்ணியாச்சு மேலேருந்து அப்படின்னா you will have comfortable analgesia. Definitely the answer is yes, paravertebral block can be used for cesarean section in large animal. And spinal needle, sir, spinal needle கிடைக்கல, 18 gauge is veterinary specific. Probably you can do with 20 gauge. 20 gauge is human, 21 is available. Everywhere it is available. So if you do not have access for 18 gauge, develop the technique or develop your protocol with 20 gauge or 21 gauge. That's all, very simple. But length will be 90 to 100 mm is available in humans, so you can purchase and you can make use of it. So draw a line over the lumbar transverse process. L2, L3, definitely it is prominent, you will never miss. So you can draw these two lines, chalk piece வச்சு வரைஞ்சிடலாம் நினச்சிட்டு. இந்த ரெண்டுத்துக்கும் டிஸ்டன்ஸை மெஷர் பண்ணி you can draw a line that will be exactly over the L1 transverse process. அடுத்தது you need only this longitudinal line. So முதுகில் தொட்டு பார்த்தீங்கனாலே you will find the muscle bundle அல்லது உங்கள் விரலில் பாதி விரல் அல்லது ஆள்காட்டி விரலில் ஒரு முக்கால் விரல் 5 centimeter away from exact midline. Definitely you will be intersecting, you will achieve the intersecting points. So and எந்த இடத்துல intersect ஆகுதோ you are going to pass the needle. That's all, very simple. Pass until you feel a resistance. அந்த ரெசிஸ்டன்ஸ் போனதுக்கப்புறம் லொடக்குன்னு உள்ளே போகும். இது எனக்கு தெரியவே இல்லை அப்படின்னா நம்ம டஸ்டருக்கு யூஸ் பண்ணுற 10 ரூபா ப்ரஷ் ஃபோம், இந்த மேஸ்திரிலாம் வந்து துடைப்பாங்கள்ல செவுத்தில், அதை ஒன்று வாங்கிக்கோங்க. லாஞ்சிடியூடினலாக ஒரு பா மாதிரி கட் பண்ணிவிட்டு உள்ளே ஒரு பேப்பரை ஒன்று சொருவிடுங்க, ஒரு மெலிசான சார்ட் பேப்பரை மேலேருந்து சொருவுங்க. ஃபோமில் போகும்போது நீடில் ஃப்ரீயாக போகும். கார்ட்போர்டு வரும்போது யூ வில் ஹேவ் ஏ ரெசிஸ்டன்ஸ். அதை பியர்ஸ் பண்ணுறது ஈஸியாக தான் இருக்கும். பியர்ஸ் பண்ணிவிட்டு போகும்போது ஃப்ரீ ஆகிடும். ஸோ இந்த ஃபீல் தான் நீங்கள் இன்டர் டிரான்ஸ்வர்ஸ் லிகமெண்ட்டை பாஸ் பண்ணிட்டீங்களா இல்லையான்றது. ஸோ 10 ரூபாய்க்கு ப்ரெஷ்ஷை வாங்குறீங்க, லாஞ்சிடியூடினலாக கட் பண்ணுறீங்க, அது உள்ளார ஒரு சார்ட் பேப்பரை உள்ளே சொருவுறீங்க, நீடில் சொருவி பார்க்குறீங்க, 20 காஜ் நீடில் அழகாக சொருவுறீங்க. ஃபோமில் போகும்போது அழகாக போகும். கார்ட்போர்டு வரும்போது, சார்ட் பேப்பர் வரும்போது ரெசிஸ்டன்ஸ் இருக்கும். ஒரு அழுத்துவீங்க, அழுத்தினோடனே லொடக்குன்னு உள்ளே போயிடும். த சேம் ஃபீல் யூ வில் ஹேவ். அந்த சேம் ஃபீல் வந்த உடனே நிறுத்திக்க வேண்டியது தான். நிறுத்திக்கிட்டீங்க அப்படின்னா யூ வில் பி பிளாக்கிங் த வென்ட்ரல் பிரான்ச். வென்ட்ரல் பிரான்ச்சில் 15 ml டெபாசிட் பண்ணிடும். யூ வில் பி புல்லிங் பேக். அந்த ரெசிஸ்டன்ஸு எங்கே அகெயின் ரிலீஸ் ஆகுதோ அந்த இடத்துல 10 ml அல்லது அப்படியே டெபாசிட் பண்ணிகிட்டே வந்துடலாம். ஏன்னா டார்சல் வந்து ஒன்லி த்ரூ அன் ஆர்க் இட் இஸ் சப்ளைங். ஸோ நமக்கு தேவை வென்ட்ரலை கண்டிப்பாக பிளாக் பண்ணி ஆகணும், டார்சலை பிளாக் பண்ணணும். டார்சலை கரெக்டாக பண்ணலனாலும் பரவாயில்ல, நீங்கள் வித்ரா பண்ணும்போது எங்கேயாவது 10 ml டெபாசிட் பண்ணிங்கன்னா கண்டிப்பாக பிளாக் ஆகிடும். ஸோ when you do at 3 sides you are going to desensitize the complete flank. அதுக்கும் அடுத்தது போகிறீங்க அப்படின்னா definitely you are going to cause recumbency. You will achieve the entire side will be desensitized. டெஃபினட்டாக சிஎஸ்ஐ எந்த சைடு பண்ணுறீங்களோ அந்த சைடு பேராவெர்டபிரல் பிளாக்கை போட்டுட்டு டெஃபினெட்லி வெரி கன்வீனியன்ட்லி யூ கேன் டூ சர்ஜரி. ஸோ திஸ் இஸ் த வெரி ஈஸி சொல்யூஷன். டெஃபினெட்லி it will do wonder. And when you do proper block you will have scoliosis. That means on that side it will be, muscles will be relaxed. So ஒரு வில்லு அம்பு மாதிரி ஆகிடும். So very easily you can diagnose. Sheep also the same technique can be used, but the quantity 1.5 ml will be more than enough. 1.5. So this is the tip. So I am pushing. Yeah, I can feel that passing the intertransverse ligament. And try to do multi-tailed bandaging. Multi-tailed abdominal. CS பண்ணிட்டீங்க, wound should not get contaminated. ஸோ வேஷ்டியை அப்படியே கட்டாமல் வால்வாலாக கிழிச்சு கட்டினா மட்டும்தான் சர்ஜிக்கல் சைட் வில் பி ப்ரொடெக்டட். நீங்கள் அப்படியே வேஷ்டியை கட்ட சொன்னால் டெஃபினட்டாக அது படுத்து எந்திரிக்கும் போது மூவ் ஆகிடும், wound will be contaminated. So do a multi-tailed abdominal bandage for surgical interventions involving flank or lower flank, anything. So it can be upper flank laparotomy or it can be a incision for cesarean section. Exploiting the surrogates. Field level la pannona ergonomics of the surgeon is very very important. Try to have a comfortable seating. அண்ணா கூட இல்லைன்னா நான் சர்ஜரியே பண்ண மாட்டேன். இந்த ஸ்டூலை எடுத்துகிட்டு வரேன், சேர் எடுத்துகிட்டு வரேன், யூ வில் கெட் டில்டட். நீங்கள் எல்லாம் ஸ்க்ரப் பண்ணிவிட்டு ஏசெப்டிக்காக பண்ணணும்னு நீங்கள் தானே சார் சொன்னீங்க. உட்காந்துருக்கும் போது சாஞ்சிட்டேன், அதனால் நான் கையை ஊனிட்டேன், அதே கையால் நான் பண்ணேன். நோ, யூ ஹாவ் டு எக்ஸ்ப்ளாய்ட். ஒரு அண்ணன் கூடைய போட்டுட்டு உட்காந்திங்கன்னா எந்த சைடு நீங்கள் திரும்பினாலும் யூ வில் நாட் ஃபால், யூ வில் பி கம்ஃபர்டபுள். இது அண்ணன் கூட இல்லை அப்படின்னா சர்ஜரியே கேன்சல் பண்ணிடுவேன். முதல் வேலை அண்ணன் கூட இருக்கா, எந்த ஊர்லேயும் அண்ணன் கூட இல்லைன்னா உங்கள் ஊருக்கு ஆப்ரேஷனுக்கு வரவே வேணாம் போங்கடா அப்படின்ட்டு. நோ, you cannot spoil your, because you do surgery as a part of practice. I am a surgeon. எனக்கு வேலையே 24 மணி நேரமும் 365 நாளும் என்னுடைய ஜாபு சர்ஜரி பண்ணுறதா இருக்கும். நாமக்கல் காலேஜில் ஹைட்ராலிக் டேபிள் வந்து இட் பிகம் மால் ஃபங்க்ஷனல். ஸோ வெயிஸ்ட் லெவலுக்கு ஹைட் வரல. we were leaning and we were doing. I lost my spine. அவ்வளோதான் சிம்பிள். அட்டானமி டீன்னு சொல்லிட்டார். அதெல்லாம் உன் பிரச்சனை, பார்த்துக்கோ. ரேடியேஷன் இன்டியூஸ் ஹைப்போதைராய்டிசம், ஐ சஃபர்ட், லார்ஜ் அனிமல் எல்லாம் எக்ஸ்ரே எடு, நம்ம அப்படியே கண்டுபிடிச்சிருவோம். என்ன ஆச்சு? எனக்கு ஹைப்போதைராய்டிசம் வந்தது தான் மிச்சம். we have to take care of our work ergonomics. So you have to have a comfortable seating when you are doing surgical interventions. நீங்கள் உட்காரும் போதே வந்து அது சாஞ்சிருமா? ஏன்னா நம்ம மண்ணில் உட்காந்துருப்போம், அங்கே வைக்கல போட்டிருப்போம், அது மேலே ஒரு தார்பாயை போட்டிருப்போம், வழுக்கும். நீங்கள் டில்ட் ஆவீங்க அப்படின்னா definitely you will not concentrate on asepsis. So this is very very important and you need to maintain asepsis, and for that you have to exploit the. So this is, so choke surgical அப்படின உடனே போன லாவால் எடுத்த உடனே so there is a improvement. So எங்கள்கிட்ட மவுத் கேக் இல்லை. So this is Dr. Lakshman from வெல்லூர். ஸோ அவன் வந்து 4-way டிவி டீ கப்பில் போட்டு பிவிசி பைப்பில், எனக்கு அடிச்சிடக்கூடாது இல்லை. ஸோ he is very cautious. ஸோ போட்டால் ஸோ very comfortably he has developed his own technique. That's all. So you can develop your own protocol, I can tell, but each one of you may have different requirement, different resource availability. So you can develop your own technique. And coming on to antibiotics, the carry home message is very simple. Don't complicate with antibiotic usage. All wound, very basic antibiotic is more than enough. Don't treat a abscess or yes ordinary wound with ceftriaxone tazobactam. No, don't go for higher antibiotics. Start with the basic thing. Understand, quinolones are broad spectrum. They do not have action against anaerobes. And if you suspect anaerobic infection, you are not supposed to select fluoroquinolones, or quinolones has to be combined with metronidazole. Probably 20 years back, if a human patient undergoes a laparotomy, they will be giving ciprofloxacin IV and metronidazole. So all quinolones, yes, they are broad spectrum. They act against both gram positive and gram negative, but it doesn't mean that they are active against anaerobes. If you are suspecting anaerobic infection, if you are suspecting peritonitis, you have to combine it with metronidazole. Start with penicillin, very basic. Definitely you can manage 90% of the cases. And the other one is dimethyl sulfoxide. Dimethyl sulfoxide can be very routinely used in veterinary practice, especially in managing surgical cases. So this will be acting as a vehicle, that's all. So aqueous lipid ரெண்டு சைடும் கொண்டு போகிறதுக்கு நமக்கு ஒரு டிரான்ஸ்போர்ட் மீடியம் வேணும். அதுதான் வந்து DMSO will be doing. So you can mix any drug and if you apply it topically, it will be transported. So locally apply பண்ணணும், but the drug has to reach. எனக்கு dexamethasone உள்ளே போகணும், but dexamethasone கொண்டு போகிறதுக்கு I will be making use of DMSO anywhere. It can be a joint capsule, it can be a muscle, it can be a tendon, anything, but try to make use of this. So 70 ml of dimethyl sulfoxide with 30 ml, that is a routine combination we use. So 70-30 will definitely do better. Make sure that when you are applying DMSO, try to put a gloves, carcinogenic, so we have to be little cautious, that's all. Any trauma, anywhere you want the drug to be transported, dexamethasone or one antibiotic, you can use DMSO as an vehicle, that's all. 70-30, that is a common ratio we use. 70 ml of DMSO, 30 ml of the drug. So neuropathy prevention. So this is my first case of neuropathy which happened after general anesthesia. After that, never I have. This is the second case which happened at Namakkal after my transfer. So only 2 cases. Remember, when you make the animal recommend on a rough floor, dependent shoulder, the animal was operated for right flank laparotomy, intersusception. So it was naturally on the left lateral recumbency over the table. Table as mat. But it developed radial nerve injury, radial nerve paralysis like syndrome. But it recovered. Aggressive steroid, aggressive physiotherapy, B12 supplementation, definitely the animal will recover. But remember, the upper shoulder has to be supported. ஒரு பெரிய hefty animal, ஒரு 300, 400 kg, 500 kg animal na, you have to support the upper limb also. If you allow it to hang, and the stretch will cause damage to radial nerve. So prolonged recumbency should be avoided. ஆனால் surgical intervention ஒரு CS பண்ணுறோம் அப்படின்னா it has to be padded. Simple thing, கார் டியூபை வாங்கிட்டு போயிட்டு இன்ஃப்ளேட் பண்ணி உள்ளே சொருவிடலாம். இல்லையா ஒரு சணல் சாக்கில் வைக்கல நினச்சி உள்ளே சொருவிட்டோம். It should not be in level with floor surface. It will be exerting pressure. ஒன்று cranial side support பண்ணுங்க, caudal side over the shoulder put some soft material. So this is how it has to be prevented. So this is a typical gait of olecranon fracture. Olecranon fracture is very common due to sudden fall, sudden jump. So olecranon process la elbow will be flexed. So it will be non-weight bearing lameness. இதில் கிரிப்பிட்டேஷன் இருக்கலாம் இல்லாமே இருக்கலாம். ஏன்னா it will be an avulsion fracture, but a typical gait will be like this, avulsion. So fracture of external angle of ilium, it will be presented as if a very serious thing. Fraction of external angle of ilium is not going to be a serious issue. அது fracture ஆனாலும் ஒன்றும் ஆக போகிறதில்ல. Animal can bear weight. It is not going to cause any harm. So definitely அந்த அனிமல்லாம் ரெக்கவர் ஆகிடும். ஆப்வியஸாக ஓனரே சொல்லுவாங்க, உடஞ்சி போச்சு, சண்டை போட்டாங்க, அடிச்சிட்டா, fracture of external angle of ilium. Don't bother. So this is the chemical restraint I have shown. So when you do proper restraining, anesthesia, analgesia, definitely you can do wonders. So intraocular worm removal, hours, anesthetize பண்ணியாச்சு, கீழே தள்ளியாச்சு, corneal desensitization with proparacaine. Surgical procedure is going to last only 45 seconds or 1 minute, maximum 1 minute. அவ்வளோதான். So 1 minute பண்ணுறதுக்கு you are going to prepare. You are going to have a plan. That's all. So a worm has been removed. So 30-35 seconds the surgical intervention. But for that you have to, if you do it in this methodical way, outcome will be good. Outcome will be successful. So the carry home point of both of my presentation is gentle handling. Wherever possible, try to use appropriate gadgets, appropriate intervention tools. If you have a smaller sized needle, go for smaller sized needle for delicate procedures. Don't take 18 gauge and don't give local anesthetic on the eye. So go with 24 or 25 gauge needle. Asepsis, wherever possible, try to isolate the surgical site from other area. You can use whatever is available. எதுவுமே கிடைக்கல அப்படின்னா எல்லா வீட்லேயும் வேஷ்டி இருக்கும், வெள்ளை வேஷ்டி. துவைச்ச வேஷ்டியை வாங்கி 2 வேஷ்டியை சர்ஜிக்கல் சைட்டை சுத்தமாக போட்டுருங்க. You completely cover the animal so that your suture, your instrument don't get contaminated from the environment. Environmentன்றதுன்னா மாடுனா சாணி மூத்திரம், இது ரெண்டுத்துலேயும் கண்டாமினேட் ஆகி அதே suture material, if we place it on the tissue, it is going to cause post-operative infection. So that has to be avoided. That's all. And pain management protocol, always remember patient-centered. We are doing, yes, we want to be safe, yes, that is only one part, but consider the other part. ஒரு காயினுக்கு எப்படி 2 சைடு இருக்கோ, from veterinary side, yes, we should be safe, we should select appropriate drug, but it should be effective for the patient. So the pain management protocol should be patient-centered, and always remember the equitable. So each individual may require different requirements. So that is a normal physiology that has to be understood, and try to incorporate chemical restraint in your routine practice. So to have a successful outcome, detailed clinical examination, you have to do a clinical examination. Diagnosis, when you do a detailed clinical examination, definitely you will come to a diagnosis. I want to stress one thing. So medicine case, downer, most of the time without examination, we start calcium, phosphorus, potassium. Probably that animal would have been suffering bilateral hip dislocation. Whatever treatment you give, it is not going to serve the purpose. Last week I had a video call with Gopinath. Half an hour we were discussing adductor muscle rupture. So yes, we have not caused adductor muscle rupture. Animal suffered. It had a fall. Veterinarian cannot feel guilty. If you administer anesthetic and if the animal dies, it is not our fault. We have taken all precaution. We are depressing the central nervous system, which is going to control all the master system. It is the master system. So there is a risk. That risk has to be explained to the owner, and that risk has to be taken up by the owner, not by the veterinarian. Right? ரோட்டில் போனால் ஆக்சிடெண்ட் ஆகும்னு தெரியும். அதுக்காக யாருமே ரோடுக்கே போகிறது இல்லையா? போகிறோம். எப்படி போகிறோம்? கார் ஓட்டினா ஆக்சிடெண்ட் ஆகிடும். எல்லாரும் காரை ஓட்டுறோம். ஆக்சிடெண்ட் ஆகிறதுக்கான ப்ராபபிலிட்டி இருக்குது. அது 0.5% இருக்கலாம் அல்லது 5% இருக்கலாம். பட் வாட் இஸ் அ ப்ரிகாஷன் வி டேக்? வி இன்ஷூர். எவனையாவது அடிச்சிட்டா தேர்ட் பார்ட்டி இன்சூரன்ஸில் கிளைம் செட்டில் ஆகிடும். அவ்வளோதான். அந்த 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 தைரியத்தில் தான் நம்ம போகிறோம். வி ஹாவ் டு கெட் ஏ கன்சர்ன் வாங்குறது தான் நம்மளுடைய வேலை. இன்சூரன்ஸ் எடுக்கிறது எப்படி நம்மளுடைய பவுண்ட் டியூட்டியோ, கன்சர்ன் வாங்குறது தான். இன்ஃபார்ம்டு கன்சர்ன். வி ஹாவ் டு டெல் த அவுட்கம் டு த கிளையண்ட் and we have to get an informed consent. It can be written consent, it can be a oral consent. But if you are going to deal with potentially depressing agent, it is always better to have a written consent. ஒரு சைன். ஏன்ட்ட இருந்த ஸ்டூடெண்ட் ஒருத்தனால எவ்வளோ பெரிய கேஸாக இருந்தாலும் they will get a consent. கன்சென்ட்டை வாங்கியாச்சு அப்படின்னா, even if the animal dies, nobody will dare to question you. But before that, you have to have a detailed clinical examination. You have to have a diagnosis. You have to tell them that, yes, I am going to administer. There is a 50% chance it can go for complication. You tell them, I want a signature. நீ இதை கையெழுத்து போட்டிங்கன்னா நான் இதை போடுறேன். இல்லை அப்படின்னா நீங்கள் ஒத்துக்கிறது ஒத்துக்காது அவனுடைய விருப்பம். நீங்கள் ஒத்துக்கல அப்படின்னா அதுக்கு தகுந்த மாதிரி ட்ரீட்மெண்ட் பண்ணுறேன். ட்ரீட்மெண்ட் பண்ண மாட்டேன்னு சொல்ல மாட்டோம். ஸோ we will do, but with a more considerate way. அவ்வளோதான். You will have a option. So அந்த ஆப்ஷன் அவன் எஸ் கோ ஹெட் அப்படின்னு சொன்னாங்கன்னா go with that. Right? So and always try to have a checklist. ஒரு சர்ஜிக்கல் இன்டர்வென்ஷன், மெடிக்கல் இன்டர்வென்ஷன், எனிதிங், try to have a checklist. Go with the very basic essentials. Always keep everything ready, at least in the dispensary. Dispensary-ல if you have a kit ready made, definitely you can manage. So asepsis you have to take care. Pain management, yes, it should be the top priority. Appropriate surgical protocol as per your requirement, and ensuring analgesia at all stages, during surgery, before surgery, post-operative, everything. And definitely post-operative follow-up is going to fetch you the name. Make it as a habit. Digitalization. You have cell phone. எவ்ரிபடி கேன் டூ. ஓனர் இருக்காங்க, ஓனருடைய நம்பரை வாங்குறீங்க, ஒரு கூகுளில் ஃபோட்டோ எடுக்கிறீங்க, கூகுளில் அப்லோட் பண்ணிட்டீங்கன்னா எனி டைம் யூ கேன் ரெட்ரீவ் பேக். ஸோ ட்ரை டு டெவலப் ஆர் ட்ரை டு ஃபெமிலியரைஸ் வித் த ஈஸிலி அவைலபிள் கேட்ஜெட்ஸ் ஆர் அப்ளிகேஷன்ஸ் ஸோ தட் யூ கேன் யூஸ் தட் ஃபார் யுவர் ப்ரொஃபஷனல் சக்ஸஸ். தேங்க்யூ. ஃபஸ்ட் இண்டிகேஷன் இஸ் crush injury. When you have bone loss along with soft tissue, where you cannot get back the soft tissue. So without soft tissue, if there is a bone loss, definitely animal will go for limb shortening. If you allow, because there is a contracture. So the normal physiological response for a fracture or osseous injury is first and foremost function of bone is skeleton. It gives the structure. So the moment it gets fractured, the first classical sign is deformity. இப்படி இருக்கிற கால் இப்படி திரும்பிச்சு அல்லது அப்படி திரும்பிச்சு. ஹியூமனாக இருந்தாலும் அதே தான். Skeleton is taking care of the weight. So first one is deformity, second one is non-weight bearing. When there is a fracture, animal cannot take weight on the. Third is pain, hemorrhage, swelling, all those things come little later. So when there is a crush injury, when there is a absolute bone loss, and if there is a absolute soft tissue injury, there is no tendon, there is no ligament to take care of the joint function distal to the fracture site. There is no point in treating that fracture. You have to go for amputation. Amputation in animals, always it should be at the level of stifle for hind limb and at the level of elbow for forelimb. Never ever do amputation at mid metatarsus or mid metacarpus, because animal will try to put weight or animal will try to use. So if it is using, it is going to cause wound dehiscence, it is going to complicate the process. So amputation should be done at the level of stifle in case of hind limb, at the level of elbow or above that. Even humerus, mid humerus you can remove, mid femur you can remove, but the minimum is stifle. At the level of stifle it has to be removed. Here it should be at the level of elbow. Anything else, madam? At the level of elbow it has to be amputated. Joints, yes, it can be either, it can be a disarticulation. Because you will have a muscle mass to cover. Yeah. It is. See, amputation is going to be a major surgery. That is why I am telling. So if we assume that mid metacarpal, mid metatarsal is going to be easy for a surgeon, but it is not going to serve the purpose. You are not supposed to. It is ethically, it is not acceptable. Humans, they do because they know that they cannot put weight on the amputated limb, but animals will not do that. So it will be causing further damage. It will not serve the purpose.